Let me take this opportunity to wish all Vermonters a very healthy and happy new year. And I wanted to take just a few minutes to discuss some of what's going to be happening in the Senate this coming year. But before I do that, I did want to mention a few of the congressionally directed spending grants that we were able to secure for the state as part of the $1.7 trillion omnibus bill that the president recently signed. As many of you know, I have long been an advocate for universal health care. To my mind, health care is a human right, and every man, woman, and child in our country is entitled to health care. Clearly, we are not yet in that position as a nation, but I am proud that we are making good progress in Vermont in significantly expanding primary health care throughout the state. As part of the recent congressionally directed spending projects, I'm proud that we were able to secure a $4.2 million grant in order to establish a new federally qualified health care satellite attached to the Springfield, Vermont medical care system in Brattleboro. The truth is that Brattleboro has lacked adequate primary health care facilities, and this will be a big step forward for Windham County and for our ability to expand primary health care to every region of the state. Bottom line is that we will now have over 65 federally qualified community health center sites around Vermont, making primary health care accessible to Vermonters in virtually every region of the state. I'm also happy that we're able to get a grant for the University of Vermont to establish an emergency medical service academy, which will provide free or inexpensive training for hundreds of Vermonters who want to become EMS providers. We have a major problem in our rural areas in Vermont and all over this country in terms of a lack of well-trained EMS providers, and this will go a long way to improving that situation in our state. Let me take a moment to mention to you that I will soon be assuming the chairmanship of the U.S. Senate's Health, Education, Labor, and Pensions Committee. It's called HELP, one of the more important committees in Congress. And by the way, just in passing, this was a committee previously chaired by Vermont Senator Jim Jeffords, so I'm proud to continue Vermont's tradition on that committee. Needless to say, when we are dealing with health, education, labor, and pensions all on one committee, we are dealing with a whole lot of stuff. And I look forward very sincerely to hearing from Vermonters as to their ideas as to what we need in our state and throughout the country and how we can accomplish those goals. But let me take a moment to very briefly tell you what is on my mind as I assume the chairmanship of that committee. And let me start with healthcare. When I think about healthcare today in America, I'm thinking about a country that spends far more per capita for healthcare than any other nation on earth. We're spending, if you can believe it, some $13,000 for every man, woman, and child in our country. And yet, our healthcare outcomes and our life expectancy is much lower than many other wealthy countries. We are a nation that, despite all of the huge amounts of money that we're spending, we have a healthcare system in which more than 85 million Americans are either uninsured or underinsured. Almost 500,000 Americans declare bankruptcy each and every year because of medically related bills, and some 60,000 tragically die every year because they can't afford the care they need and get to a doctor on time. So that is just a huge set of issues that we have got to address. Why do we spend so much money and yet are not getting the quality or affordability in healthcare that we need? And I should say, that while all of this is going on, needless to say, the insurance companies are making tens and tens of billions of dollars a year, every year in profit. But it's not just healthcare in general. It is the issue of prescription drugs. And there is something, again, very wrong in a system in which we spend, as a nation, far, far more than any other country on the medicines that we need. In fact, as many of you recall, I've taken people across the border into Canada, where you buy products like insulin for literally 1/10 the price that we pay here in the United States. So one of the issues that my committee will be dealing with is taking on the greed of the pharmaceutical industry that makes, again, huge amounts in profits every year, charging us the highest prices in the world for prescription drugs. So that's an issue that we are going to tackle. And part of that is that we don't have a system in which seniors, among others, get coverage for dental care, for vision, or for hearing. So I'm going to be working hard to make sure that we can expand Medicare to cover those very basic health care needs. I can go on, but bottom line is that in the wealthiest country in the history of the world, which is what the United States is, our healthcare situation is really almost beyond comprehension. And we need major, major, major improvements in healthcare. And we must have the courage to stand up to the greed and recklessness of the insurance companies and the pharmaceutical companies. So that's one issue that we're going to be dealing with, and that is healthcare. And the other issue that we're going to be dealing with certainly is education. And there's so much to be talking about in terms of education. Let me just touch on a few issues that I expect the committee will be dealing with. And that is, right now, I'm thinking about a nation in which billionaires receive huge tax breaks. So you got some billionaires out there who literally pay nothing in federal taxes. But meanwhile, our teachers and our parents lack the financial support they need to provide the quality education our kids deserve. And I'm also thinking, all of you are aware, of a country where hundreds of thousands of bright young people who have the desire to get a higher education, but they can't do that because their families lack the money. And on top of all that, we got some 45 million Americans who are struggling with student debt, and in some cases that student debt is, hundreds and hundreds of thousands of dollars. So we got to deal with the affordability of college. We got to deal with student debt. In my view, we have got to make public colleges and universities tuition free. But on top of all of that, that's just higher education. Then we've got to be thinking about early childhood education. And I think, as any working parent in Vermont knows, we have a child care system which is in deep, deep trouble. It is enormously expensive. In Vermont, on average, a working parent spends about $15,000 a year to put a child into childcare. That's about the national average. And not only is that just outrageously expensive, if you're making $40,000 or $50,000 a year, how do you spend $15,000 for one child in childcare so you can go to work? But on top of that, the truth is there are not enough childcare slots available for our parents in Vermont, and in fact throughout the country. And on top of all of that, the nature of the childcare world is that the people who do the work, the people who work with the little kids, are grossly underpaid. So in terms of education, we got to worry about the quality of public education in general, make sure that we attract the best and the brightest young people to become teachers who do enormously important work. We've got to fix a very dysfunctional early childhood and pre-K system, and we have to make higher education affordable to all of the young people and older people who want the opportunity to get a higher education. And then when you talk about this committee, it's health education, it's also labor. So what's going on there? And today, when you think about the condition of working people, I'm thinking about an economy which clearly is rigged, in which we have an unprecedented, never before have we seen anything like this, unprecedented level of income and wealth inequality. And that means that the billionaires are becoming much, much richer, while 60% of people in America live paycheck to paycheck. And many millions more are trying to exist on starvation wages. And we are a nation in which a whole lot of people want to join a union because they think that a union is a step forward in terms of being able to negotiate a collective bargaining agreement, earn decent wages, decent benefits. And you have like major corporations at Starbucks, Amazon, and elsewhere who are fiercely and illegally resisting the efforts of working people to form unions. And then on top of that, we've got to raise the minimum wage to a living wage. People can't make it on 10, 11, 12 bucks an hour. And to my mind, we've got to raise that minimum wage to a living wage. And we're trying to work with organizations right now to determine what that number is. But, in the United States of America, it should be a truism that if you work 40 hours a week, you're not living in poverty. And that's not the situation now. Now, I am not naive, and I do know something about politics and how the Senate and the U.S. House operate. And, I don't believe that as soon as I become chairman, I'm going to bang my gavel on all these pieces of legislation that I want to see passed, they're going to get passed. That ain't going to happen that way. There are going to be a number of issues where Republicans and, in fact, conservative Democrats are not going to support what I'm trying to do. But that doesn't mean that we're going to give up on those issues. We're going to take the fight to the American people because all of the issues that I'm talking about are, I think, popular ideas, and it's what the American people want. They want to see a Congress representing working families, the middle class, and not just wealthy campaign contributors. And the truth of the matter is, if you look at the polling out there, reducing the cost of prescription drugs and insulin is enormously popular. Expanding early childhood and higher education is enormously popular. That's what the people want. Raising the minimum wage. We see state after state going forward because the federal government has not done its job. And the truth of the matter is that, if you're a Republican, you're a Democrat, you're an independent, you're a progressive, you're a conservative, you know what? You can't make it on 11 or 12 bucks an hour. You can't afford the outrageous cost of prescription drugs. So hopefully, on a number of issues, important issues, we can make progress by bringing Democrats and Republicans together to do the business of America and to do what the American people want. As chairman, I'm not only going to be working here in the nation's capital, but I'll be taking the show on the road, so to speak, into Vermont and throughout the country. I want to be talking to ordinary people and find out what's going on at their workplaces, find out what's going on at their schools, find out about the cost of prescription drugs from their own lips, find out how they're feeling about healthcare. So we're in this together. I can't do it alone. The American people, I've got to learn from the American people. We've got to work together. And mostly, I think the American people are going to stand up and demand that Congress start listening to the needs of ordinary Americans and not just, the lobbyists that dominate what goes on here in Washington or the big corporate interests. So there's a lot that we've got to do in the next couple of years. I'm optimistic that we can make some real progress. So I want to thank everybody in Vermont for the help they have provided in this process. I look forward to getting around the state and hearing what you have to say. So thank you all very much. And once again, have a wonderful new year. Take care.